Good evening, everyone, and thank you for joining us. Tonight, we're here for the COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer. I'll be joined shortly by my colleague and co-host, Dr. Kelly Kam. We are members of the Health Research Institute and college professors here at Michigan Tech University. We'd like to give a warm welcome to all of our viewers watching tonight on the Zoom webinar and all of our listeners tuning in on 97.7 The Wolf. It's great to have you back. Tonight is our third town hall. We need to recognize our sponsors, which I mentioned. Our presenting sponsor is UP Health System Portage. Our featured sponsor is the MTech Smart Zone. And our two community sponsors include Upper Peninsula Power Company, and we have a new community sponsor on board tonight, Aspirus. We really appreciate the support of all of our sponsors. Their help and support allows us to have the broadcast both on Zoom and on the local radio. Our Health Research Institute is organizing the Town Hall series. We also have additional support from the Center for Educational Outreach. I just want to mention that the mission and the goal of the Health Research Institute is to promote health-focused research, education, and outreach here on our campus and in our local community. As I mentioned, tonight is the third Town Hall in a series of 12 that we're having every Thursday evening from 7 to 8 right here on Zoom and on 97.7 The Wolf. If you happen to miss any part of tonight's town hall or over the past few weeks, you can go to our website and you can download those and watch those recorded versions. Our website is at the bottom of the screen. It's mtu.edu/health-research. Each week we focus on a different COVID-19 related topic. The goal of the COVID-19 Community Town Hall series is to increase our awareness about COVID-19, how it impacts your health, the health of our community, and society at large. So far, we've learned about the role of public health in protecting the community. Last week, we focused on how our community is preparing and putting emergency protocols in place. Tonight, we're moving on to a new topic and going to learn more and think about how COVID actually impacts us and our body. For example, why does it make it harder to breathe? Tonight, our featured speaker will be Dr. Tara Robinette, who is an emergency medicine physician and works at UP Health System Portage. So we'll bring her in here in just a few minutes. Before we do, I want to bring in my co-host, Dr. Kelly Kam. You know, so far, Kelly, we're about a quarter of the way through our Town Hall series already. Can you believe it? And we thought this was a great time to provide a mini COVID-19 update. So welcome back, and we're looking forward to a brief update by you to help us kick off our Town Hall.
All right, well, thank you very much. Yes, like Dr. Elmer said, that we're a quarter of the way through and things are changing all the time. And that's part of the point of our presentations here, are to try and understand what we know and what we don't know. And part of that is always changing. One of the things that we wanted to start off with tonight is that we talked a little bit about the infodemic, as World Health Organization calls it, which is this idea that there is so much information out there. It's really hard to tell what's the real information and what's the false information. And the World Health Organization has these great Mythbuster websites. And so we thought we'd feature one of them tonight as we get ready for the first widespread frost that I heard on the radio today that is coming tonight in our area. And so this belief that the misconception that cold weather could kill this, and in fact, cold weather and snow do not kill it. We know this from the number of cases we had. Certainly this started in January and February. So there's no reason to think that the cold weather can kill this virus or other diseases. What is important is to make sure that you're washing your hands, wearing your mask, and keeping socially distant from other people, physically distant. Can I have the next slide? So worldwide, just an update on what's going on. So we have an estimated almost 30 million cases of COVID-19 that are recognized in the world right now. This is as of this morning, with almost 950,000 deaths across the world. So this is another example. I think last time we showed the World Health Organization dashboard. This is from Johns Hopkins University's Coronavirus Resource Center. And for our students in the audience, this is another example of a good resource that you can use to look for valid and reliable data. The important thing to look at is down at the bottom, it has the data sources and the full list. So you can actually look and see where they're getting their data from. This website is actually drawing their information from a variety of national, state, and local health departments and other sources that they are getting this from. So as we can see in the United States, so I don't have a separate slide for this, but in the United States, of these almost 30 million cases, then about 6.5, a little over 6.5, about 6.6 million cases are in the United States. And of that 950, almost 950,000 global deaths, about almost 200,000 of them are deaths in the United States alone. And the other thing that I want to point out here is that when we look at the data, so as an epidemiologist, I'm used to looking at a lot of different kinds of data, but in the general population, and a lot of our students are coming from a wide variety of backgrounds, that looking at these different data can be cumbersome to try and figure out what they're trying to say in here. And for example, if you look at the bottom here, what we're looking at with these red dots here are the cumulative cases. So the cumulative cases may not show the full picture of what's currently going on in the landscape. And so I would encourage you as students and anybody else in the community to look at these websites and really browse through the data and see what else is going on. So for example, if you looked at active cases, which is the next tab, and I don't have a slide of this, you'll have to go and look at it yourself. But in that active cases, you'll see that while we continue to see a lot of cases along the eastern seaboard and in California, that we have areas of active transmission in other parts of the country that we didn't see previously. And so, and also as we expected, we're seeing increases where we're seeing increases in movement and gatherings like we've experienced locally with our universities opening and our schools opening, as well as our workplaces opening up more. As we are getting out more, then there is more opportunity for transmission that we have to remember. So next slide, please. So in Michigan, we have over 125,000 confirmed and probable cases. So again, to think about that difference of what it means between confirmed and probable. So confirmed is that we had a laboratory test that confirmed the virus presence. A probable case is someone who has clinical signs and symptoms that indicate they have COVID-19 and they have a known exposure. So those two parts together, they actually give us a very strong indicator that that person has COVID-19, even if they haven't had a test. So that's why we group those together, but do separate them, but count them when we look at these numbers. So in here, the total number of cases in Michigan puts us at the higher end compared to other states. But when you look at the number of cases adjusted for population, then we fall lower compared to other states. So again, this is just the absolute number of cases and not adjusted for the population. And intuitively, you understand that we need to think about that there's a lot of people in Michigan compared to, say, one of the, someplace like Wyoming. And so it's not unexpected that we would have more cases in a more populated area, but we want to be able to compare state to state. And in that situation, we need to really look at not just the absolute numbers, but the numbers comparatively to the population in our states. And as you can see, we still have a wide variance in the case counts across the state. Also, there are population differences across the state, so we need to consider that when we're comparing areas. But even so, looking at, we know up here in the Western UP, we have a very small population in these areas, so seeing numbers and higher numbers up there is concerning, certainly to us. Go ahead to the next slide. So this is, again, looking from the Michigan State data on where we are as a state. And it does look like potentially we are on the downward trend, but at least a leveling off here, if not somewhat of a downward trend. But again, thinking about where that data is coming from and what that data means. So this is the number of cases by date of onset of symptoms. And you might not get that information right away. So by the time you have symptoms and your symptoms are to a point where you go in for a test or you seek medical care, it might be that your symptoms have been occurring for quite a few days. And so someone who has symptoms in the middle of September might not seek care until the end of September, and then the numbers would be added back in. So we often, at the right side of the graph there, we need to take into consideration that those numbers might not be totally accurate. So a downward trend right there might be more of a problem with, not necessarily a problem, but a little bit of delay of getting the data. All right, we'll go to the next slide. So looking more locally here in Houghton County, we have seen a sharp increase in cases in the last week or so as our students have returned to Michigan Tech and Finlandia. And thinking back to those comparisons, we have to remember that we've also increased our population significantly in the past couple of weeks. So it might not be entirely appropriate to just look at straight numbers, but to look at the numbers compared to our population increase. Now, certainly that increase in numbers is concerning, and we want to do everything we can to keep those numbers low. But that numbers in and of itself are only part of the picture, and we have to think about the rest of the picture as we do as well. The other thing that you can see down on the bottom with the Michigan Tech testing is that we've done a significant number of tests. So many of our students know that there was a large push to get students tested as they came in, as they moved into the residence halls, as well as doing surveillance testing throughout our campus community. Which will find cases that are asymptomatic that we might not have otherwise recognized. And we are not, to my knowledge, are not doing widespread surveillance testing in our community. So these are cases that would not have necessarily been identified. Okay, so another part of the picture that we have to think about is thinking about the different waves of cases and how those waves are happening. So as a little bit of an introduction to what we're going to talk about next week, have the next slide here. Oh, sorry, forgot about this one. So this is again from the Johns Hopkins, from their coronavirus website, and you can look at individual data here from individual county level. So again, it's a different way of looking at it. It down at the bottom provides some information that comes from other sources about social indicators that may possibly put our community at higher or lower risk. Information about our medical infrastructure and our high-risk populations, so populations that are in poverty or over 65, and gives some running information. So you can see that 654, that's the number of cases per 100,000 people in the population. Our county has only 36,000 people without the students in the population. So obviously that number seems a little strange to us, but that's so that we can compare that number to other geographic areas. And the other thing that's interesting here is to look right above that 654 number and looking at the number of cases in the last 14 days. And you can see that there's a big spike that happened right there, which was about the Tuesday after Labor Day. So we had done, here at Michigan Tech, we had done some testing in areas where we thought there might be more transmission going on, and we did in fact find more cases in that area when we tested there. And so you can see that spike. So when we test areas where we expect to find cases and in fact do find cases, that does increase our spikes and shows that. But then you can see once we started doing a more, it levels off after we have moved on to more general populations within our campus community. All right, next slide, please. So as I was saying, we were thinking about how we think in terms of this big spike in cases and what might be an explanation for it. It is not necessarily the only explanation, but a little bit of a thought process as to what might be going on in college campuses. So quarantine is a control measure that we use to prevent subsequent spread of disease past an initial case's close contacts. So you have the person in red up there is our infected case, and they have 6 close contacts. And the gray ones are the people who become infected. So out of that, and this is an example, this is not to be taken as that every 2 out of every 6 people that are in contact with a case will become infected. This is just an example to show that if you had 6 cases, and for example, or 6 contacts, and say for example, 2 of those contacts became infected. If we had no containment or no mitigation procedures in place, then that number would double. So we go from 1 case to 2 cases, to the next generation would have 4 cases, and doubling again with the next generation of 8 cases. So without any kind of mitigation, then we would be doubling our cases every generation, every spread within our line of infection here. And so what we're trying to do is stop the spread at those close contacts. So by the time we identify a case, they have already had and already exposed those close contacts. There's nothing we can do about those other than making sure they're getting appropriate medical treatment and making sure then that they are quarantined to stop them from spreading it any further. So that's what we're trying to do then, if we can effectively quarantine people there, is to stop that spread from a further perspective. But the number of people in that first generation, that 2 in this example, depends on a lot of different factors. Go to the next slide here. And so one of those factors that I want you to think about in terms of a college campus is it really does matter on how big your household is. So when we were first under the stay-at-home orders, and if you were in a household like mine that had 4 people in it, if one person became sick, and say we had 1 out of every 3 people that they had close contact with became infected, then that first generation of cases would only be 1 additional case. If you had a small household that had some additional outside contacts, so that that infected person had 6 contacts, then we're looking at going from 1 case to 3 cases. That's still pretty problematic, because if we don't stop it at that point, then we're going to double our number of cases every generation. The problem is that when we look at this from a campus community where our students are often living in large congregate housing, or at least have multiple members of their household, if you had someone with a household of 12 different household members, then the size of that first generation is now 4 instead of 2. So that jump from the first generation to the second generation is really big, and that might be simply an artifact of how our students live. It can be other issues as well, but this is one example of what may be going on and what we have to really understand, and not just look at our numbers of cases that we have, but really understand what is going on in our community and how it's spreading. Because in all cases, if we quarantine effectively, then we won't have any spread, or we'll have minimal spread into the next generation. And we won't have that jump from 4 to 16, or from 2 to 4. We would have a jump from 1 to 4, but then we would have a stop at that point. And that's something that we'll think about as we move forward into our into the sessions that we have in future webinars. But tonight, thinking about how does this impact those 4 or 5 or 2 people in terms of their individual medical care and their individual impact on their health. And with that, I would like to...
Thank you, Kelly. One quick interim question for our listeners, because I know it might not be intuitive for everybody. The difference between the surveillance testing and then on the slide we also have the baseline testing. Can you just clarify for our viewers and listeners?
Sure. So diagnostic testing is what we use if someone has a reason to be tested individually. So they're symptomatic, or they're a close contact, and they have reason to believe that they are infected with COVID. They go in, and at Michigan Tech, our lab does that as an individual test, and that gets reported to the state numbers that show that we have had a test and whether or not that test has been positive. So it shows up in those positivity test numbers. Here at Michigan Tech, we are also doing surveillance testing. So we are trying to understand what's going on in our community that we wouldn't necessarily identify because they don't have symptoms. And so we are asking students, they are randomly selected, and we are asking students to come in as long as they do not have any symptoms. So these are students that are not symptomatic, they are not under quarantine as a close contact, and they're not positive cases. They have not either had a positive test, or they are not currently positive or symptomatic for COVID cases. So these are our general population that are healthy students that are out there. We ask them to come in and get tested. And when they get tested in a group of pools. So we pool 5 students together. And and we'll hear more about how that testing is done. But that surveillance test allows us, because we can pool in groups of 5, we can test those large numbers of people. And so, whereas in the general population, testing, if there's not a reason to test, is often not done. And we are doing that here. Now, one of the issues that shows up is that our surveillance test, if you go back to that slide with our numbers of tests that we've done, that 3,940 tests, a lot of those tests were our baseline tests, as well as our surveillance tests that are going on. And right now, those tests, the number of tests are not counted, our pooled tests are not counted in the Michigan State numbers, but our positives are. And so if there's any positives picked up in the surveillance testing, which there are, they will get reported as a positive test, but our numbers of completed tests are not necessarily reflected in the state numbers. So they are appropriately reported as a positive test, but when you look at the positivity or the test positivity rate, those numbers are different from what Michigan Tech reports versus the state, because the state is not counting our negative tests from our pooled testing, or our not detected tests.
Okay. Great, thank you, Kelly. And I know next week we're going to talk more about testing and tracing and vaccines, so stay tuned for that next week. For those listeners on 97.7 The Wolf that are just tuning in, we're here for the COVID-19 Community Town Hall, which is presented by UP Health System Portage, along with additional support from the MTech Smart Zone, Upper Peninsula Power Company, and Aspirus. If you would like to join us on the Zoom webinar, you have two options. You can head over to thewolf.com and click on the link for the Zoom webinar, or you can go to our website at mtu.edu/health-research and click on Town Hall. Next, we're going to bring in Dr. Tara Robinette, who is an emergency medicine physician. She's also the medical director in the emergency department at UP Health Systems Portage. I do want to say she has a very busy schedule. Her shift does overlap with our town hall here, so we're really appreciative of her coming on and making time for this. So Dr. Robinette, welcome to the program, and thank you for everything that you're doing so far in our community. Just get the, we just need her to unmute the microphone, so give us a second here. I think we got it all squared away. So Dr. Robinette, welcome.
Technical difficulties there. So yes, I am Tara Robinette. So I'm here to discuss the COVID virus, the symptoms, how it affects the body, and how it's treated and prevention. So COVID-19 virus is it's a virus that is in a family of coronavirus. Coronavirus is common, it affects humans, animals, and it's a common virus that causes the common cold. However, this COVID-19, which is severe acute respiratory syndrome coronavirus 2, is a special type of virus. It's a new virus that we've never seen before and that our bodies have never experienced before. And that's part of the reason that it has basically spread like wildfire and caused many deaths. So this virus is like any other cold virus. It enters the body through your respiratory system. So that's through your nose, that's through your mouth, that's through your lung. Either you breathe it in, you touch it, you touch your mouth, etc., you get it. It causes a wide variety of symptoms, from common cold symptoms to influenza symptoms to severe shortness of breath and chest pain. The most common symptoms, which you can have none to one to all to somewhere in between, is fever, chills, cough, shortness of breath, fatigue, body aches, headache, loss of taste, loss of smell, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. Just from our experience with it in the medical field, I have seen an extreme wide variety of symptoms, to people that are just fatigued, people that only have a fever, people that have a fever and headache, to people who, you know, have cough and severe shortness of breath. So honestly, you can have any of those symptoms. The majority of people who get it are going to have mild symptoms. They're going to feel like they have a flu-like illness or have a cold, recover quickly, or may have symptoms that last for a few weeks to a few months, but, you know, may get tested, probably won't have to seek medical attention. You know, there's a intermediate symptoms where, you know, you're going to be down and out in bed for several days and take a while to recover, to very severe symptoms to where you're going to be hospitalized, sick, and those that, you know, that pass away because of it. The people who get really sick, they can be the young and healthy, but most commonly they're going to be in the elderly and those with other medical problems like asthma, COPD, heart problems, diabetes, etc. Many people ask, you know, what's the difference between influenza and COVID? They do cause similar symptoms, but they're complete separate viruses. Influenza is a separate virus from COVID. They're different families. Influenza, we have some immunity to, even though there's a new strain every vaccinated. Many people have been infected with influenza prior, so there's some background immunity, where with COVID, for majority of people, there is not. And it's true, influenza, you can have mild symptoms to be really sick and die because of it. But typically the deaths from influenza we see due to the bacterial complications. That means you get influenza and then you get pneumonia, and then that causes you to be really sick in the hospital and pass away. Versus the deaths that we're seeing from COVID is the direct effect of COVID on the body. How COVID attacks the body. So as we talked, it gets into the respiratory system and then it affects the body's cells. The specifics is that it attaches to the ACE2 receptor, and that's how it gets in. This receptor is most abundant, meaning there's the most of it in the lungs, the air sacs in the lungs. The air sacs in the lungs are what deals with the oxygen we breathe in getting into the blood, which is necessary to live. So that causes a severe inflammatory reaction in these cells, which is obviously most severe in the lungs because that's where we have the most receptors, but also affects many other organs in the body. The specific inflammation of the lungs causes, basically, you're not going to get the oxygen into the blood, you feel short of breath, you have trouble breathing, and that's the major consequence or the major reason that we see people seek medical attention for. When it's so bad, it can require you just to require, supplemental oxygen to get through it. So that means, you see people wear a nasal cannula, the two little prongs of the tubing on their face, a little bit of that, to very severe where you're on a ventilator and basically we're breathing for you, to the most severe, which is ECMO, where all your blood is basically taken out of your body, put oxygen in, and then put back in. That's kind of the most severe form of it, which a lot of those people don't make it. And even people on the ventilator don't make it. This virus also attacks other parts of the body. It can cause inflammation in other parts of other organs, other parts of the body, and can also, we've learned, cause blood clots and cause you to have heart attacks, strokes, and blood clots in your lungs, which is another cause or another reason that you can get super sick from it. So what should you do if you think you have COVID, you have symptoms of COVID, or you've been in close contact with someone with COVID? You should stay home. You should tell those around you that you have symptoms and stay home. You should also probably get tested. I'm quite impressed with what we have been able to do for testing in the Copper Country. So just from the portage aspect, since that's what I experience, testing that's available is through Express Care. So it's drive-through testing. You call ahead during their normal business hours, you register, and then you drive up and you get swabbed. The test results, or the tests currently, obviously this is a moving target, but are taking as short as 24 hours to a couple days to come back. UGL is also doing testing, so that's the primary care offices associated with UP Health System Portage. They're doing drive-up testing also by appointment during their business hours. Aspirus is doing testing also, but I don't know their specifics as I don't work there. And then if you are positive, you need to stay home and quarantine per the CDC guidelines. Currently, the CDC guidelines are that from onset of symptoms, you should quarantine for 10 days as long as your symptoms are improved and you are fever-free for 24 hours without use of ibuprofen or Tylenol or anything that can reduce your fever. If you have contact with someone that is positive for COVID, you should quarantine for 14 days from your last contact with that person. And again, that's a moving target, but that's the current recommendations from the CDC. Many people ask when you should get help. When do you need to go to the emergency department because you have COVID? So general guidelines, I can't give you specific medical advice, but general guidelines are if you have severe shortness of breath, severe chest pain, severe dizziness, you're passing out, you have blue lips, then you should probably come to the emergency department. If you need to come to the emergency department, if you have a mask, you need to wear a mask inside the entrance. You come in the emergency department walking entrance. Don't come in the ambulance bay. And if you don't have a mask, we'll apply a mask to you right away. Tell the attendant there that you have symptoms consistent with COVID. We'll register you, and as soon as we have a room available, we'll move you to a private room. We try to put all of our COVID possible patients in negative pressure rooms. So a negative pressure room means that the air inside that room gets sucked out and doesn't go anywhere else in the emergency department or the rest of the hospital. We also protect ourselves from any possible COVID patients as healthcare workers. That includes wearing a mask ourselves, a face shield, a gown, and gloves. Many people also ask, what's our capacity at the hospitals to treat COVID? There's no treatment for COVID that's, you give it, you're going to get better, kind of like an antibiotic for strep throat. There's some medications that we think that help. But currently there's no proven absolute that this is going to make you better. In terms of if you're at home with COVID, there's again, some things that may help, like vitamins and things like that, but there's nothing I can prescribe you to automatically make you better. If you're wondering what you should take, you should call your doctor and ask for advice. In terms of our capabilities at the hospital to treat COVID patients, we have rooms that we put the COVID patients in. Again, they're these negative pressure rooms. We have the ability to expand. If we get multiple COVID patients and have a COVID unit, we have the ability to keep patients who have a severe difficulty of breathing and be on a ventilator. We have many plans in place should the event happen that we have a lot of COVID patients in the hospital. Obviously we can't take care of every patient because we're a small hospital and we don't have every specialty to that a patient should arise, but if there's something that we can't handle, then we would transfer you to the nearest hospital, which that has availability, which would probably be Marquette. The final thing I want to talk about is prevention. So we are all sick of COVID. I'm sick of COVID, but COVID's not sick of us yet. It's still in the community. The cases are rising. As much as we're done with it, it's not done with us, and it's not going to go away anytime soon. So we all need to do our best to prevent spread. You need to stay home as much as possible. When you need to go out, you need to wear a mask, whether that's to the grocery store or church or whatever. You need to do your best not to touch your face, distance yourself from others, and wash your hands frequently. And most important, if you're sick at all, whatever symptom you have, just stay home to prevent the spread to others.
Thank you, Dr. Robinette, for that great information. One of the themes that we're seeing emerge in our town halls, there's a lot of information out there, some of it's misinformation, so we really appreciate your insight and expertise as somebody working with patients on the ground level. Can you elaborate a little bit more about how long the symptoms last? And I want to also ask a follow-up point is, there's in the news, we're hearing about people that are termed long haulers. So could you comment on those two? How long the symptoms last, and then what is a long hauler, so to speak?
Yeah, so the symptoms last a very variable amount of days between patient to patient. I've seen patients, they feel sick for a couple days, then they're better. Some patients are sick for 7 to 14 days, then better. Other patients, they'll have what we call acute illness, so the bad symptoms, for 7 to 14 days, but then they have this prolonged where they feel short of breath, they have this prolonged cough, and that can honestly last for months. And even the patients who have been really sick and been hospitalized, they continue after the acute illness, the illness that needs medical attention has gone away, they continue to have symptoms for months and months and months. So it's unfortunately very variable from person to person, and like I said before, it's people who have comorbidities, other medical problems, and the elderly are more likely to have more severe courses and more prolonged courses, but that's not 100% rule. We've seen, the very young and healthy also get very sick and have very, very long courses of symptoms.
I want to follow up on the aging point that you just made there. In our community here, we know that about 20 to 30% here in the western part of the UP are over the age of 65, and that's above the state and national averages. So what can we do here in our local community to really protect those older individuals because they're at such high risk from your perspective?
So if you're sick, stay home. Wear a mask when you're out in public, because that protects yourself and others. Because we don't, in the community, we don't know how many asymptomatic carriers there are. Tech is starting to get an idea with their tech population. But you could be positive and not have any symptom, never have a symptom, but you're around someone who's elderly and you pass it to them and they have symptoms from it. So you wearing a mask, they're wearing a mask, stay home as much as possible, wash your hands, just basic things like that. Prevention is going to help us beat this.
Okay. Just want to remind our viewers and listeners, there's a couple different ways to send us questions. They're coming in here. If you're on the Zoom webinar, you can go to the bottom and click on the Q&A button and send in your questions. And then you can also email us at townhall2020@mtu.edu. Let's move on. This is a question from a community member here. So does COVID-19, Dr. Robinette, make you more likely to get other illnesses if you have previously had COVID-19?
Potentially, yes. We don't know the full extent of that yet. But whenever you're sick with one thing, whether that be COVID or influenza, you're more likely to develop complications, whether that be a bacterial pneumonia. Commonly in kids, when we see they have a viral URI or a cold, that sets them up to get ear infections. So the long and short of that is yes.
Okay. Another question that we have here. In general, how are healthcare workers doing, so to speak? You said the virus is still here. We're ready to be done with it. But, how are you and your colleagues doing just in general?
I think, I personally got a little hiatus from it because I just returned from maternity leave. But, talking to my fellow nurses and physicians, we're all doing okay. Thus far, we've been fortunate that, we haven't seen the surge of sick COVID patients, like Detroit or New York has. So we haven't experienced that level of burnout. But, we're just starting to see where we're having a lot of respiratory symptoms, testing a lot of people in the ED for COVID. Thank goodness, a large percent of them have thus far been negative. But, we're all hanging in there. We're probably more done with it than the general community, but we also want to be on the forefront and help the patients that we can help.
Yeah, you guys are doing a critical service to our community. We thank you. Next question is with ventilators. Can you talk a little bit about when a patient is put on a ventilator, do they usually survive? What's kind of that survival rate?
Yeah, so I don't have the exact statistic on, the percentage of COVID patients placed on a ventilator that survive, but many of them do. Generally the ventilator is used for, someone who's having a lot of difficulty breathing, their oxygen level is really low, or another, something you breathe out, CO2 is really high, and that's why they get put on the ventilator. But I don't have the exact percentage, but majority that are put on the ventilator do survive. But generally there are people that also pass away that are on the ventilator. So just because you're on a ventilator from COVID is not a death sentence.
Okay. Could you talk a little bit more about the underlying medical conditions that we hear all the time about being, if I have one of those, I'm at an increased risk for severe illness with COVID. You mentioned those briefly, but could you elaborate a little bit more? And then why do these underlying conditions put people at increased risk?
Yeah, so the people who are most at risk is anyone with any lung condition. So COPD, which is emphysema and chronic bronchitis, which we commonly see in people who are or were smokers, and people with asthma, along with many other lung diseases like pulmonary fibrosis, interstitial lung disease, patients on oxygen. And the reason for those patients is because COVID attacks the lungs predominantly over other organs. So if your lung capacity, or you already have lung problems to begin with, and then COVID affects it, you're going to be greatly more affected, and your risk of getting really sick and dying is higher. With other illnesses, any illness in your body, any chronic illness in your body makes you less able to fight against any illness, whether it's pneumonia, COVID, influenza, or whatever. So if you already have, you think of someone who's, up here, who's completely healthy to fight it, and then you have someone with an illness who's down here, and they both bring them down, the patient with the chronic illness is gonna drop further in terms of symptoms, and their ability to fight it is gonna be lower.
Okay. Here's a question from a student, good question. The student said that, I've been to the CDC website, and I know that obesity is a risk factor as well. And the student's asking, my parents are overweight, but they're not obese. Are they still at increased risk?
So as far as I know, the theory behind that is that generally people who are overweight and obese have more medical problems. And so if you have more medical problems, then you're more likely to get sicker from COVID. So theoretically, you know, if you're overweight, yes, it could affect you more.
Okay. We're going to give Dr. Robinette just a quick break here. I want to bring in my co-host Kelly Cam. Kelly, there's a couple of questions for you that have been coming in as well. So I will summarize a couple here. Kelly, this one came in talking about how many days from possible exposure before symptoms may show up.
So that's what we call the incubation period. And that for this disease, as far as we know, can range from anywhere from 2 to 14 days. So it can take a full 14 days for someone to have symptoms arise after an exposure. And that's why we have that 14-day quarantine period, because we want to make sure that you are under quarantine and you're away from other people for that full time period where you could develop the disease. So we wouldn't want to let you out at 7 days, because close to half the people that develop symptoms develop them after day 5 or 6. And so we don't want to let you out until that full 14 days are reached.
Okay. Kelly, another question for you. You've shown us quite a few maps of the world, of the United States, the state of Michigan, a lot of different colors there. This question came in talking about Houghton County was just coded red and now it's changed to orange. Can you talk about those color switches or changes that are going on and just elaborate more?
Sure. So this is coming from the state of Michigan. So the state has determined that they have these threshold ranges for saying if a region or an area is high risk, medium risk, or low risk for community transmission. And that has to do with our Michigan Safe Start plan. And there's different regulations and recommendations for community gatherings, for schools, for universities, at these different levels of community risk of transmission. So the high risk is according to the state, and I'm actually reading this right now from the Michigan Safe Start website, that a high risk is above 40 new cases per day per million residents. And if it's a medium risk, it's below 20. So I'm sorry, if it's a red where we were before, then that's at or above 40 new cases per day per million residents. Below 20 new daily cases per million is medium risk, and below 7 new cases per day per million residents is low risk. So I was actually trying to look up and see how long they are determining that that daily where you have to be at that daily point, because it's most likely, and I couldn't find it in the time that the person had asked the question and defined it, it's not going to be changed probably on a daily basis. They're probably looking at that daily rate over a certain period of time to make that determination to change. So as we have fewer cases, daily cases showing up, then we will change risk categories. And you do have to be careful that just because it's red on one map doesn't mean the same thing as red on another map.
Okay. Appreciate it, Kelly. We're just over halfway through, a little over halfway through our COVID-19 Community Town Hall. We're talking with Dr. Kelly Cam and Dr. Tara Robinette from UP Health System Portage. Again, if you do have questions, you can, they are coming in at the bottom of the Zoom webinar using the Q&A function. You can also email those to us at townhall2020@mtu.edu. We do have quite a few questions. We're doing our best to sift through these, right, Kelly, and answer as many as we can. We'll circle back to Dr. Robinette. Here's a question for you. A couple ones that have just come in here. Give me 1 second here. What concerns are with COVID-19 impacting the heart? You talked about some of the other organs beside the lungs, but this person's asking more about what could it potentially do to the heart?
Yeah, so in terms of COVID-19 affecting the heart, the first thing is the thrombosis, the blood clots. So basically a heart attack is when you get a blood clot in one of the arteries in the heart. So they have seen people who come in with chest pain who are having heart attacks who end up testing positive for COVID. And that's basically promoting those blood clots going into the arteries in the heart, giving you a heart attack. So that's one way. We've also seen something called myocarditis. So COVID, as I talked, causes inflammation. So it can cause inflammation of the heart called myocarditis, and this basically makes the heart not be able to pump adequately. And so the ability to pump the heart or squeeze, or called the ejection fraction, drops really low. And that's another way that it affects the heart.
Okay. Very interesting. Dr. Robinette, we've heard each week in each town hall the importance of a flu shot. There's another great question that came in. I know I'm supposed to get my flu shot here. Where is the safest and best place for me to go? I'm a little hesitant to go into the clinic right now for obvious reasons, but what can you elaborate a little bit on the importance of flu shots and where folks can get them and when they should get them?
Yeah, so the flu shots are just starting to come out currently. Influenza typically up here hits us later than the rest of the country. Typically we start seeing our first influenzas January and February. With COVID this year, who knows what's going to happen? So the earlier you get it is the better. So they're just starting to become available. So if you get it now, it's perfectly fine. So in the importance to get them this year is, so we're going to have all the normal respiratory viruses, the common colds we see. We're going to have influenza going around and COVID. You could get influenza and COVID at the same time, and that could lend you to be really sick. So if you get a vaccine against influenza, you know, the chances are you're less likely / unlikely to get influenza. That eliminates your risk of having multiple illnesses at the same time, which can give you severe symptoms and put you in the hospital. So where to get them? So Express Care offers influenza vaccines. I don't believe they're offering them now. Your local doctor's office offers them. And then I believe a couple of our pharmacies like Walgreens offers them. I understand our patients are hesitant to go into any medical setting. But if you wear a mask, wash your hands, you know, stay away from other people, your risk of contracting illness while you're there is pretty low.
Okay, good reminders. And thank you for the insight. Question here about if a family member has Crohn's disease, are they at increased risk for severe illness with COVID?
It's the same thing as, you know, if you have a comorbidity, another illness of some sort. You know, you're not fighting COVID with a full tank, so to speak.
Okay. This one's a interesting question from a student related to professional development. This is highly relevant as we have a lot of students I know listening. What advice would you have for students who plan to go into healthcare in the near future, given that we're in a pandemic right now?
So getting experience in with the pandemic. It's a little harder to come and shadow people in the healthcare field currently. But just being, you know, investigating, be insightful. If there's other ways you can get involved to help, that's the best to get experience and, you know, basically build your CV, your resume.
Okay. Next question is here is, as a physician, where do you get your information? We highlighted a couple of websites earlier, the CDC, the Michigan.gov coronavirus, but where do you get your information?
So I go to the CDC for the most up-to-date in terms of quarantining and how long patients should quarantine if they're positive, if they've been exposed. And then also we have several other resources that we use. Up-to-date is a common medical resource that we use to get the most up-to-date information, hence up-to-date. Mm-hmm. Many of us are also available or part of Facebook groups related to COVID. And other physicians share the most up-to-date information, resources. And then in the hospital itself, we have a COVID physician task force where we get together. It's a group of physicians from several different areas in the hospital and talk about the most recent data information. And that's how we develop a lot of our protocols.
Another question here coming in from a community member. If you're asymptomatic and you have COVID, does that mean that you have a healthier immune system?
Not necessarily. At this point, we don't quite understand why some people can, you know, have the virus and not get any symptoms, and then other people do. So not necessarily.
Okay. Kind of following up on that, what would you say is the biggest misconception about COVID-19?
I would probably say the biggest misconception is the symptoms it causes. some people will be like, oh, I just have a sore throat and I had a fever yesterday. I don't have COVID. Well, yes, you could. Or I don't have a cough. I don't have COVID. Well, you very well could. We've seen that it's caused such a wide variety of symptoms. And I've, myself been surprised, patients I've seen who have tested positive, and I really would have just told them, oh, you just have a cold. So that's probably the most common misconception in the community currently.
Okay. I'm going to bring in Kelly Cam, our epidemiologist, back, and there's another question here. You had touched a little bit on this on your update. We have students that are in our community now, both from Finlandia and from Michigan Tech and Gogebic as well. If a student tests positive, are they counted both here in Houghton County and the county that they live in, for example, downstate? Are they counted once, twice? Can you just clarify?
Sure. So this is an important part of why you need to update your student addresses, because for understanding the spread in the community and controlling the spread in the community, we need to know, and the health department needs to know that you are where you are at the time that you have the infection. So for our students, they are residents of Houghton unless they are going home when they get sick, which if they do that, they need to be in touch with our health department before they move at any time. And so they are counted in our numbers. Now, earlier in the summer, there had been cases of individuals who were up here visiting, and then were sick at the time that they came up here, and well, not sick at the time, they got sick while they were up here. They sought care up here, so they were counted up here, but then they were removed when they went back. As far as our students are concerned, they are living here, they are residents of Houghton County, and they will be counted here. Now, if a student is remote and is living in Marquette and is working entirely remote, then they would seek care in Marquette, and they would be counted in the Marquette County numbers. I actually don't know for sure that they would necessarily be counted in our student population at Michigan Tech's website, but from the county, they would be counted in the county that they are currently residing in.
Okay. Thank you, Kelly. Another question here for Dr. Robinette. Is there anything folks can do from a diet perspective, altering their diet if they have COVID, or even before contracting the virus, or any nutritional supplements, anything that diet can play a role?
There's been some studies that have shown vitamin C and zinc have helped prevent and fight COVID. I would talk to your physician before you implement any vitamin C or zinc supplementation. But in general, just eating healthy, it's going to protect you, keep you healthier, which is going to protect you from getting COVID and getting sicker. If you get it, you still want to make sure you may not feel like eating, but you want to make sure you're getting nutrition in, getting healthy sources of nutrition, and getting fluids and electrolytes in.
Great. On a diet-related note, can you tell us a little bit more about the loss of taste and smell? Those are symptoms, right? And do we know exactly why that's happening?
No, last I heard, we don't know exactly why. That came at least a month after COVID started. People, reporting, I can't smell, I can't taste. And so that is unique, from what we've seen of viruses to COVID. And I haven't seen any data exactly why, it causes that. I did read something that if you have COVID and you lose your sense of taste or smell, you're more likely to have a milder course.
Okay. Another question came in here. We know that the number of cases has increased, Dr. Robinette. Is our hospital system, is it overwhelmed, or how will we know when it's overwhelmed?
So in terms of a lot of the COVID positives that we had, they've been diagnosed what we call in the outpatient world. So express care through Michigan Tech, through their family doctor's offices. We have diagnosed a decent amount in the emergency department, but a lot of them we have discharged home. We have had very few that have required admission to the hospital. And we've only had one death in Houghton County so far, knock on wood. So we're seeing, I would say we're there's several facets to the hospital. Our inpatient world, so that's when patients are sick and admitted to the hospital. That hasn't been overwhelmed by COVID. At times in the ED, we're overwhelmed in terms of we're seeing, patients for COVID testing plus our normal population. But that, that goes up and down every day. So in general, so far up here, we're busy, but we're not overwhelmed.
You mentioned earlier, Dr. Robinette, about this notion of a negative pressure room or chamber. Can you tell our listeners and viewers what that is exactly and why is that so important?
Yeah, so COVID is spread through respiratory droplets. So I cough, I sneeze on you, I have COVID, I'm spreading COVID all over. So the negative pressure, basically they're in a room that sucks all the air out, filters it, and then puts it out into the environment, versus it going into the general circulation, the general ventilation of the hospital. So that's basically how the negative pressure works. It keeps it from going into the rest of the hospital. With COVID, it's spread via respiratory droplets, and so we don't want it going through the ventilation in the hospital and potentially exposing many, many more people. So we do our best at any time we have a potential COVID positive patient in the ED, and definitely if we have any COVID positive patients upstairs admitted, that we put them in this negative pressure room so we don't run the risk of infecting other people in the hospital. In the past, our negative pressure rooms were used for certain illnesses, like tuberculosis was the most common. So, we only have a set number. However, our maintenance staff, in conjunction with the medical staff, has done a great job in making basically what we call makeshift negative pressure rooms. So making it possible to expand and have other rooms that are negative pressure should we be overwhelmed with COVID patients, so we can keep the hospital safe.
This will be our last question for this evening, and I'm going to pose it to both of you. Dr. Robinette, we'll start with you. This is from a community member, and I appreciate the humor. This gentleman talks about, we live in the Upper Peninsula. There are a lot of trees. It's heavily forested. How will we know when we're finally out of the woods, so to speak, with everything COVID-19?
That's a good question. I don't think we're going to be, first of all, I don't think we're going to be out of the woods for a long time. When all this started back in March, we're like, oh, it's a few weeks, it'll be fine. Well, now what? It's September. We'll soon be in October. So, I mean, I wouldn't be surprised if a year from now we're still having COVID outbreaks. In terms of once our community is not going to be out of the woods until the entire U.S., the entire world's out of the woods. Because anytime we're out of the woods, we think we're out of the woods, our cases are down, oh, we're not getting new ones. All it takes is one person going to a city or interacting with someone with COVID and bringing it back, and it could potentially spread like wildfire. So I don't think we're going to be out of the woods for a very long time, unfortunately. So no one should be putting their guard down anytime soon.
And Dr. Cam, how about you as we start to wrap things up here?
I would agree. I think it's going to be a long time. I think one of the things that we're going to get better at, and we have gotten better at since this has started, is we're getting better at being able to manage it. And as we get further along, our systems get better. Certainly at Michigan Tech, we've been developing a lot of things from scratch of how to manage things. The hospitals, as Dr. Robinette's talking about, with developing those the surge capacity and being able to switch things around, that flexibility. We've learned a lot and continue to learn a lot, and we can hopefully implement things, but I agree, it's going to be a long time before we're out of the woods.
Well, I want to thank both of our speakers tonight. Dr. Kelly Cam, we'll see you next week, Kelly, so thank you for serving as co-host and another presenter, and especially Dr. Tara Robinette from UP Health System Portage. We appreciate you coming on, fitting this into your schedule, and all of the hard work that you and your colleagues are doing in the emergency department. I also need to thank our sponsors, UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, and Aspirus, also along with the Health Research Institute and the Center for Educational Outreach. Really quickly, there's a number of people working behind the scenes. Kelly and I are up here every week to have this platform to better inform the community here about COVID-19. Lydia Lido, Cody Kangas, Cassie Munoz, Grace Schmitz, Jody Lehman and Kelly Christensen, we really appreciate your support behind the scenes. Thank you to all of our listeners on 97.7 The Wolf and all of our viewers on the Zoom webinar. We look forward to seeing you next week. Our topic will change. We'll be focused on virus transmission, testing, tracing, and vaccine development. Certainly those are important topics in the news right now. If you missed any part of tonight's program, you can go to our website, mtu.edu/health-research. So have a good rest of your evening, and we'll see you next week for our next COVID-19 Community Town Hall.